The angel of death. It's a chilling phrase, one that conjures images of the grim reaper and the inevitable end. But what if the angel isn't a shadowy figure, but someone you trust? What if the angel of death is a caregiver? This is a dark and disturbing reality that, unfortunately, exists. Caregivers, the people we entrust with the well-being of our loved ones, sometimes cross the line. They become killers, committing acts that are both horrific and difficult to comprehend. Why does this happen? The reasons are complex and varied, often intertwined and difficult to untangle. Sometimes, it's about control. A caregiver might feel overwhelmed, trapped by the constant demands of their patient's needs, and resentful. They may see their patient as a burden, a weight that prevents them from living their own lives, and the act of killing as a desperate and twisted way to regain their freedom and autonomy. Financial gain can also be a significant motive, a dark lure. The death of a patient can trigger insurance payouts or inheritance, providing a tempting, albeit illegal and immoral, incentive that can corrupt and overcome even the most basic human empathy. Mental illness plays a role too, acting as a catalyst in many cases. Some caregivers suffer from conditions such as severe depression, personality disorders, or even psychosis, which severely impair their judgment and lead to violent acts, sometimes without conscious awareness of the severity of their actions. These are just some of the intricate and often tragic factors that can transform a caregiver, once a symbol of support and compassion, into a killer. The victims are often the most vulnerable individuals in our society: the elderly, the sick, and those unable to defend themselves. Those most dependent on the kindness of others. They are completely reliant on their caregivers for survival, making them tragically easy targets for those with malicious intent. The methods used by these caregivers, the instruments of their dark deeds, are as varied and chilling as the motives themselves. Some use medication overdoses, surreptitiously injecting their patients with lethal drugs, slowly poisoning them from within. Others smother their victims, suffocating them with pillows or blankets, their actions a silent testament to the ultimate betrayal. Still others use more direct methods, such as poisoning with everyday substances or inflicting blunt force trauma, leaving behind gruesome evidence of their calculated actions. Detecting a caregiver who is a killer can be extremely difficult. Often, there are few outward signs, making their crimes even more insidious. The caregiver may appear loving and attentive, masking their true intentions with a facade of care and dedication. They may go to great lengths to build trust and deceive, making it nearly impossible to uncover their sinister plans. Families must be vigilant, constantly observing and looking for red flags, no matter how small or insignificant they may seem. These include unexplained and sudden changes in the patient's condition, particularly a rapid decline in health, any sudden or unexpected deaths, especially those lacking a clear medical explanation, and any unusual behavior exhibited by the caregiver, such as a lack of remorse, excessive secrecy, or a sudden change in attitude. If you suspect something is wrong, trust your instincts, even if they seem unfounded or based on flimsy evidence. Speak up and report your concerns to the authorities without hesitation, providing any and all details you may have, no matter how insignificant they might seem. Caregiver murders are a serious problem, a stain on our society. They represent a profound betrayal of trust, a violation of the sanctity of life, a moral failing of the worst kind. By understanding the complex motives, the horrifying methods employed, and the subtle warning signs that may indicate danger, we can work together to prevent these tragedies from happening, to protect those who are most vulnerable. We owe it to the victims, and to ourselves, to ensure that caregivers remain caregivers, not killers, and that those who seek to harm are brought to justice.